All right, we forgot about y'all, but one of our wonderful students reminded me that we needed to do this. So we actually been reviewing, so we're gonna start, we'll just stop back. The other video has us, I actually got into female a little bit, so this would be a good point for us to pick up, and thank you for reminding me, okay? Thank you, dear. Okay, so just looking at the girl, now this is kind of a side chainsaw view, you never gonna see this, right? But it does kind of let us see that, you know, we can see, that right off the bat, you can see the three openings in a woman's lower anatomy, right? We have the anus here with digestive system, right? Then we have the vagina with the cervix and uterus, right? And then we have the bladder right above it, but below the clitoris right here. So kind of a cool picture there. You can see that. All right, and here we have how the ovaries lay in the pelvic girdle. We would actually look at these bones in lab last semester, right? So pretty cool seeing how that all works, right? You have that ovarian ligament and the broad ligaments, the Spencer ligaments that hold the ovaries in place. Okay. And we're going to dive and take, I think we're going to start looking at the, here it is again. Here's a cool picture showing the whole thing. I think this is one of my favorite views. And you can see what's going on here. A couple of things to mention here. Remember, we have the cervix, which is this boundary between the uterus and the vagina. For childbirth to occur, it's got to dilate 10 centimeters. Okay, that's pretty good size, right, for the baby to be able to come through. The uterus is a very cool organ. I want y'all to be sure in lab today to see. I think I showed it to most of y'all in my lab, but if y'all saw those, the uterus of a pregnant cat. I had a pregnant cat in one of my labs, right, and it swells up really big, right? And then another pregnant cat is just really no bigger than your finger. Okay. So this, so this is one of the coolest organs door. It can get so big. Just think about it, the baby, it gets huge, and then it swells up, and goes back down to normal size. But it has three layers here. It is perimetrium. Myometrium is the muscle layers where you have the cramps that you would have, muscle cramps during your period. But it's the endometrium lining, this epithelium lining is what is shed each month for the woman, and this is what comes out in your menstruation. And I'd say probably 4%, or maybe less than a quarter of men even know that. They don't understand that at all. But I think that's kind of cool. If we know everybody to the body, I think it makes us able to communicate a lot better. So that is what you shed each month, okay, ladies, when you have your period. Now, some ladies, based on the anatomy of their uterus and their fallopian tubes, just their anatomy, the fluid is still coming out the vagina. Some of it goes back up the fallopian tubes, and these cells are alive, and they will bind to this cell, and it's very painful. And this is called endometriosis. So endometriosis, for some of these living cells that should be going out in the period, in your menstruation, they go up here and they bind to these cells and scar it up. And in many cases, scar it up to where an egg cannot come down or a sperm cannot go through it. And this is where a lot of infertility occurs. Okay. Okay, this is something I think is very important to know there. Okay. All right, can I see all that there? Okay, pretty cool. Okay, so now we're going to ovulation. This is where the egg is released. Okay. And then we have the womb, right? We've already seen the parts of that. Okay, I'm going to slide through some of this on this anatomy. We're going to get on to okay, another one here, the external genitalia, these vestibula, these structures on the outside, these folds of the skin in the female area, reproductive area. Clitoris is an interesting structure, which we just saw it in the side view. This is the same tissue that makes the head of the penis in the male. And this is the most sensitive area of the female. This is where the most nerve endings are, the other part of the female, and that is actually embryonically the same tissue that makes the head of the penis in the male. Okay, and it does become engorged during sexual stimulation, so it is an erectile tissue, and it will swell up, and it's very sensitive. And just FYI, if you get into reading some of this in the book, I'm not going to read all through it, but this is the part where a woman would be stimulate this to reach an orgasm. Okay. Just FYI, okay, that is what the book says there. Okay, episiotomy is an interesting thing. This happens a lot of times when a woman is during childbirth, when they're trying to have vaginal birth. This would be involving a cutting of, you can see a picture here, let me back up, but a cutting of some of this area back from the vagina, open it up a little bit toward the anus to allow the baby to come out easier. And what happens a lot of times during childbirth, it will tear, and if it tears, it's very hard for it to sew that up to heal. So it's easier to cut open the vagina a little bit, get the baby out, and then sew it back up, sew the vagina back up. So the episiotomy is that cutting open of the vagina to help the childbirth. Okay, I think that's an interesting thing to know. Okay, moving on. Okay, here's another one of those urban myths. Let's mention that one, the hymen, right? This is a structure. Now people ask, this is a connective tissue structure that kind of holds the vagina together, but it does not seal the vagina off, or you can have a period. So it's just like connective tissue. I use a bad metaphor, please. It's kind of hit me. But how many of y'all have ever put like a bag, like a garbage bag in the garbage can, and it's all closed together? You just kind of have to pop it open a little bit, right? It kind of opens up a little bit. That's kind of what happens here. First time a woman has sex, or this can happen in gymnastics or riding a horse. Sometimes the jarring would cause this to open up. Okay. Now, historically, we have done, I think we treat women very bad in this world, right? Y'all know we've not been very not kind to women in the past, right? But in some worlds, it's still there's still cultures where if a woman's not a virgin on her wedding night, that they could kill the wife, they could stone her or whatever in some parts of the world. Okay, but it's kind of like a double, what's the word? A double standard. It's okay for the guys to have had sex, right? But if a girl has, it's like sacred, right? I mean, that's something wrong. Like even that Queen of England is not supposed to, whoever the king marries supposed to be a virgin. Craziness, right? But anyway, this is where it would come from because of this. So you could still have Oscar Hyman and still be a virgin. Okay, so it's not a very good indicator. But anyway, it is a real structure. So usually, the first time a girl has intercourse, there'll be a little bit of bleeding or spotting that day or after that. Okay, due to this opening up. But it is a real structure that has a lot of mythology or whatever associated with it. I would say one more thing here, kind of bad here. I apologize for this picture right here. Do we really need that picture? I don't think so. Okay, that's not the best flattering picture I've ever seen. As a matter of fact, one of my favorite moments teaching is I had like a 35-year-old woman in here one time, and I hit that picture. And actually, in the old AP book, it had every piece of the female genitalia labeled on its own slide. So it's like 20 slides in a row of that. Okay, and I'm like, did we need 20 slides in a row of that? No. And so finally, this woman said, I rarely have ever been just stopped by a class, okay, by a student, just asked me something, just throw me off in 30 years. This woman wrote me down. She just said, where's the boy? And I went, what? And she said, where's the unflattering boy picture? Since we have this unflattering girl picture, right? And I said, what do you mean? And she said, I want a picture of a guy who's been swimming for 3 hours and then let him lay legs all spread out and see what that looks like. And for those that don't have little brothers, their things kind of hides after it swims a while. Okay, so it's like the turtles, the turtle in the shell. Okay. Anyway, good point. I give her the author's phone number to call and maybe have that picture put in there. But you can see here the female genitalia parts. I'm just going. You can see them all labeled here. We're not going to label that on the test. Okay, milk gland, milk production, mammary glands. Kind of put that in here too. Talks about how they make milk, right, and all that. And then we talk about breast cancer, very serious stuff here. Especially, look at this, if you have these two genes identified, so you can have a genetic test and see if you have the BRCA1 and BRCA1 and 2, then there's a high chance you will have breast cancer before the age of 50. Tremendous, to where even several famous people who have this gene have completely had their complete breast removal. Okay, and then you can have implants if you want to, but this is really a very dangerous thing. Second most common type of cancer in women after skin cancer, over 200,000 cases a year. Few men can get this too, because we do have some breast tissue and it can happen here. And so you want to get these mammograms regularly. Here is a tumor. This is what it looks like on the mammogram. Right? And so I think right now the AMA is recommending after the age of 40, you should start getting mammograms, something like that every year, and looking for this. Now, I'm no doctor, but my understanding is statistically, some of the mammograms are not showing success. You know what I mean? It looks like, from what I understand, it's not, and this is just my understanding, it's more important which type of cancer you got than however you catch it. You know what I'm saying? If you get the really dangerous one, it don't matter however you catch it, it's going to be very life-threatening. So a lot of weird variables there, but I still recommend getting your mammogram, right? Okay, I'm not saying don't do that, but just when we run the numbers, it doesn't look like we're saving as many people's lives as we would have hoped doing the mammogram. Does that make sense? It's like the numbers are not justifying the means there, but definitely do it. And of course, do your self-exam. If you're feeling dots or anything like that, that is a sign of cancer or a lymph node swelling or something, right? So definitely do your self-exams every month or so. Mammograms right there, it talks about that. Can detect small ones, right, that you might not feel. Recommended over the age of 50, every 2 years, right? And if you have a history of breast cancer after the age of 40. Okay, and of course, lots of stuff there, chemotherapy, radiation, and of course, removal of the breast itself. Okay, now here's the part I like is looking at how the female cycle works. Okay, we have a big 10-point question on our test about that. I'm going to, obviously puberty, when it hits in, And then menopause is when the woman stops her cycle, right? So you're going to ovulate about 300 to 400 eggs in your lifetime. And most of y'all are going to have like 1.5 kids, right? I always felt something like half a kid right now. But you know, some couple has two, you have one, that's we get the half there, sorry. A little humor today. But what we're going to see is this maturation of the eggs. Before you're born, all of your eggs have gone through meiosis 1, and they're sitting here waiting to do meiosis 2. And you actually don't do meiosis 2 unless sperm is knocking on the door. And we like to think, we theorize that egg needs to divide real quick and be a fresh dividing egg, because you're going to then divide, you know, once the sperm hits it, your zygote, fertilized egg, and then you divide into 100 trillion cells, whatever our body has. How does it trigger? Don't go to the hormones here. This is the part I like to show this picture. I'm going to skip over this part. This is the ovarian effect. There's ovulation. See, I told you it swells up and ruptures out, and the egg is laying, and then all this fluid that comes out. Okay. And then after the egg is released, the cells left behind the ovary form a corpus luteum that secretes progesterone and estrogen for 14 days, and then it dies. It becomes this corpus albicans, okay? And that's just showing, that's the ovarian cycle showing what happens. We're going to see it all in the contents. And that's the picture I want you to memorize, or at least draw out, or however you want to verbalize it out. But this is the 28-day ovarian effect. So the egg is selected, swells up, ruptures on day 14, and then these cells left behind make progesterone and estrogen, and then it dies 14 days later. Let me get the picture here. I like this. This is where I kind of skip to the day, and then they put them all out there. I like them all together. Look at this. Okay, so this is kind of the big picture, and we're going to spend about 15, 20 minutes to look at that. So what I just showed you was the what happens to the ovary itself, right? Actually, hold on, there it is. So here is what we just saw, the ovary. This is what happens to the ovary, right? Here are the two anterior pituitary hormones, FSH and LH, and notice they peak on day 13 and 14, causing ovulation. They obviously have effect on the ovary. Then the ovary makes estrogen and progesterone, specifically estrogen in the first part, and then progesterone in this corpus luteum phase, last 14 days. And then if a baby don't implant in the endometrial lining, then the corpus luteum dies, and then you start another period. So it's progesterone dropping that causes you to ovulate. Okay, causes you to have your period. Okay, let me get a pen. Okay. So this is one more time. So day 1 of your cycle, you're your period. So day 1 is the first day of the cycle, and that's when your period starts. It can last for up to 5 days. So you're shedding that endometrial lining. Very unlikely if you get pregnant during that time, because there's nowhere for the baby to implant. Okay, now I'm not saying it can't happen. You know, every time we say it's 100% what happens, somebody proves us wrong, right? So, but in general, that is pretty well considered. You're not going to get pregnant during your period. Okay, now. As this happens, look what happens. FSH and LH start to rise, and these are made by the, I had a pen going here. Oh. So this starts to go up, and this comes from the anterior pituitary, and that triggers the selection of an egg to start to swell. So the egg is starting to swell, and as it's swelling, progesterone levels are being produced here, and they start to go up. And that triggers you to stop having your period and regrow your endometrial lining. And on day 13, we get a huge surge of LH, and that triggers ovulation the next day. Now, we had a crazy aha moment Monday in here. I mean, like crazy aha moment. The young lady sitting over here where you're sitting at, threw her hand up, and when I showed her this, she said, hey, then a girl can't get pregnant for like 2 or 3 days. It's the only time she gets pregnant in the cycle. And I went, we have had a teaching moment today, right? Because you're only good, you can only get pregnant right here in these 2 or 3 days. When that sperm hits that egg, right, then it goes down, and you're only good for 2 or 3 days there. So that is called the rhythm method of birth control. So if you do not have sex on the day you ovulate, and maybe the day before and the day after, that's about 75–80% effective in preventing you from having an unborn child. So just say no 2 or 3 days, right, and then you got a pretty good chance not to get pregnant. Okay. Now, once this happens and the egg is going down the fallopian tube, these corpus luteum then starts to produce progesterone levels, and these stay up. Now, if the baby if you haven't had sex and there's no sperm in here, then all that's lost, and then around day 24, progesterone levels start to fall off, and bam, you start your period again on day 28 or 29th day, starting the next cycle. Now, if a baby implants in here, watch, this is pretty cool. Then the placenta-forming structures produce a hormone called HCG. This is called human chorionic gonadotropin. That goes to the brain, tells the girl that baby's on board, no FSH and LH. So these get cut off completely for 9 months, for the entire pregnancy. Wouldn't it be a nightmare to give birth to your kid on Monday and then the doctor said, we'll see you next Friday for little Jimmy? You know, like you had them lined up like that, like you can have one this week, have another baby in 2 weeks or another month. It'd be a nightmare, right? Kids raising is crazy, it's wild enough. Okay, look what else happens here. Once that baby implants, then these levels go through the roof. And that is what I call the excitement, the roller coaster that is a pregnant woman. Now, I'm not picking on anybody, but if you've ever been around a pregnant woman, the word rational and calm is not usually the word I would use, right? Very emotional, because you're on an estrogen high, progesterone high. Matter of fact, I'll just tell one personal story here that we after we had our first kid, we were trying to have another kid, and it was in summer school, and my wife got pregnant, and she was doing good. She was about 2 or 3 months, maybe 3 or 4 months into the pregnancy, and she called, and I was actually teaching here. She was at home, and she said, "Hey, I'm spotting some blood." I said, "We'll go up to our doctor, you know, at Boone, my doctor, the one I talked about in class." So she went up there, and he did a blood sample of her and checked her progesterone levels, and they should be like right here on month, you know, where we're at in the pregnancy. He said, "I want you to come back by Friday, and we're going to check it again. If it has not gone up, then something's wrong with the baby. You're probably going to have a miscarriage." And so when she went back on Friday, the progesterone levels were here, which indicates something was wrong, right? She couldn't have a period, right? And she lost the baby that Sunday. Now, in my conversation with my friend on Friday, I'm like, "Well, why don't we give her progesterone and keep the baby?" He said, "Is that what you want to do? Do you really want to do that?" And I had one of these, you know, this is the aha moment. He said, "If we give her progesterone, the chances of the baby making it are like 5–10%. And if it did, I'm going to tell you something bad wrong with it. It's got some major developmental problem, you know, missing parts or something, brain ain't functioning right, because my wife's body was what? Rejecting that baby because it wasn't right." And so we didn't do those treatments because we just said let nature take its course, which is what he recommended. Okay, so we lost that baby that Sunday, and I probably didn't handle that very well. I just said, "Well, you know, in my mind, we can just try again next month, right?" In her mind, she lost the child, right? So it was a very traumatic thing for me, and she went through a really hard depression for a long time until she got to church one Sunday in a women's class, and some came up miscarriage, and half the room, or 2/3 of the room, had a miscarriage. So, you know, company makes, you know, comfort, you know, other women could then confront, could tell everybody been through that. And so if you try to have 3 or 4 kids, there's a high probability you will have a miscarriage. Like 1 in 5 pregnancies ends in a miscarriage, which is something they don't ever tell us in class, right? I'm sure they get that from you. I don't think my mother told my sister that, okay? Or anything like that. We wouldn't tell that. But pretty impressive stuff here, right? If the baby implants, these go through the roof. This lives for about 6 months, and then the placenta itself makes the hormones for the last 3 months. Now, how many of y'all heard of postpartum depression? That's another real thing, right? Well, let me give you a good reason why. You're the center of the universe, right? For 9 months, right? You're carrying the little alien, right? You're carrying the baby. But as soon as you give birth, where does all the attention go? To the baby. Don't worry about mama. And then look what happens. Now the hormones go back to normal. So now you're in the Betty Ford clinic for drug addiction. Now you've been snorting estrogen straight and progesterone for 9 months. Right now you're back to normal, 28-day cycle, right? Y'all cold? Okay, let me know, because y'all know I'm overweight. I'll be glad to cut that hair off or whatever. But is that not amazing when y'all get it, right? If you're on your little 28-day cycle like this, all of a sudden you're on a high roller coaster high, and then come back down to normal, that is withdrawal. And I've seen my wife, literally, we had a couple of days where she almost went crazy with our first baby, right? And I wouldn't leave her alone with it. Okay, and then finally she got coming back to herself. Okay, it was really pretty wild for me. All right, comments, questions. Okay, that is a 10-point question. Everybody's fine. You need to draw it out, write it out. It's in your book, or it was written out on 2 or 3 pages in your book, or you can kind of draw this and walk me through it, okay? So I want you to, this is a big one. And then I think I got another question is what happens when you get pregnant, right? So then you get right here and what? Then this stays, these levels go up, right? And you don't have another ovulation. And so when you do a pregnancy test, girls, guess what you're looking for? HCG. That's the hormone we're looking for in your urine. And then when you go to the doctor, they're going to draw blood and find it in the blood. Human chorionic gonadotropin is the hormone that triggers that was produced within about 2 days of getting pregnant. All right, comments, anybody? Y'all been very quiet. Y'all scared me today. Ma'am? That would be number 5, yes. And number 6 was the part I drew once the baby's on board and we quit the cycle and we go into that, all the hormones go up. That's correct. All right, now we're going to spend about another 10, 15 minutes and we'll talk about birth control, I believe. And then just kind of blow them up here. And actually, let's watch the video. Let's let her walk us through it. I got to cut the pin off. Sorry.
Ovarian cycle is a monthly series of events that happens in the ovaries. During this cycle, an oocyte completes its maturation inside a structure known as the follicle and is then released from the ovary. In this animation, we'll examine the stages of the ovarian cycle and the hormones that are involved. The ovarian cycle is under control of the hypothalamic pituitary gonadal axis. Gonadotropin-releasing hormone, or GnRH, from the hypothalamus stimulates the release of follicle-stimulating hormone, or FSH, and luteinizing hormone, or LH, from the anterior pituitary. FSH and LH then stimulate the start of the ovarian cycle and the production of estrogen by the maturing follicles. The ovarian cycle begins with the follicular phase. Before entering the follicular phase, a primordial follicle containing a primary oocyte becomes a primary follicle. Primordial follicles form before birth and contain primary oocytes that have arrested in prophase 1 of meiosis. During childhood, primordial follicles grow into primary follicles. The follicular cells change shape from flattened to cuboidal and form several layers around the oocyte. They're now called granulosa cells. Note that nothing happens to the primary oocyte and it's still arrested in prophase 1. As childhood continues, the primary follicle enlarges even further to become a secondary follicle. The granulosa cells secrete follicular fluid that collects in small pockets. A layer of endocrine cells called thecal cells forms around the follicle. The granulosa cells then start to produce estrogens from the secretions of the thecal cells. The secondary follicle still contains a primary oocyte that is slowly growing. Starting at puberty, rising levels of FSH and LH stimulate a small population of secondary follicles to continue maturing. Usually only one secondary follicle completes maturation to become a vesicular follicle, also known as a tertiary follicle, a process that takes about 90 to 120 days. The final part of the vesicular follicle's maturation occurs during the follicular phase of the ovarian cycle. During this phase, the vesicular follicle develops a single large cavity, or antrum, filled with follicular fluid. Near the end of the follicular phase, the primary oocyte completes meiosis 1 and gives rise to a secondary oocyte and one polar body that will disintegrate. Keep in mind that the follicular phase is primarily driven by FSH. As the follicles grow and mature, they produce increasing amounts of estrogens. The elevated levels of estrogens initiate a positive feedback loop to the anterior pituitary, which results in increased LH production. This surge in LH stimulates the next phase of the ovarian cycle, ovulation. During ovulation, which happens around day 14 of the cycle, the wall of the vesicular follicle ruptures and the secondary oocyte is released. The oocyte is surrounded by a layer of granulosa cells called the corona radiata. The oocyte will then enter the uterine tube and begin its journey toward the uterus. If it gets fertilized, it will complete meiosis too and give rise to an ovum and a second polar body that disintegrates. During the last phase of the ovarian cycle, called the luteal phase, the remnants of the ruptured follicle become a corpus luteum. The luteal phase extends from day 14 to day 28 of the cycle. The corpus luteum secretes some estrogens and large amounts of progesterone. This progesterone will be essential for maintaining the early pregnancy if fertilization occurs. If fertilization does not occur, around day 24 of the cycle, the corpus luteum degenerates and becomes a knot of scar tissue called the corpus albicans. Production of estrogen and progesterone stops, and the levels of these hormones decrease. The levels of LH and FSH also decrease due to negative feedback to the hypothalamus and anterior pituitary. This marks the end of one ovarian cycle.
Wow, pretty good, right? I mean, just to hear it somebody else, maybe sometimes that helps. There's all of our players, right? Female response of reproduction here. Interesting to note that the woman does not have an orgasm to get pregnant, right? We know that, from the rape and stuff like that. Obviously, terrible things that happen. The female libido or sex drive is determined by basically adrenal cortex testosterone, DHEA, and testosterone makes adrenal gland. So if a woman has no libido at all, then that is a sign something's wrong. It could be a hormonal problem, right? Puberty, now we said it earlier, between 9 and 12 years of age, right? And then we talk about menopause is when the woman's cycle stops late in life, right? And you can take estrogen replacement therapies here. One of the big problems with menopause is osteoporosis, right? The hormones get thrown off, remember, and you keep breaking down your bones and don't rebuild the bones, right? We talked about that to y'all already. All right. Female infertility is usually 60% of the time is the problem, I believe. We can do in vitro where we take the eggs and we put the egg and sperm together, then drop them down the female reproductive system to be implanted in her uterus, right? So we have several methods of that. All right, birth control, obviously behavioral absence and rhythm method is when you use your monthly time in your cycle so that you don't have sex on days of ovulation. And then the most common birth control method probably in the Northwest is the withdrawal corpus interruptus, where the male does not ejaculate in the female. Then we have the barrier methods here that have the male condom on the right and then the female condom on the left. And so this is something a lot of y'all may not be familiar with, but a female condom can be put in by the woman and then the male's penis goes into the bag, okay? And so that way you have some protection. Something that's we don't see a lot anymore, but very used to be real common in the 80s, 70s, diaphragms can be fitted. The woman can put a cap over her cervix so that the sperm will not go up. Then she has spermicide in there so that she would be with her partner, and then later on the next morning take that out, wash all that out, and get that out. And you can buy the cervical cap. There used to be one, I think they quit making it. You can buy at Walgreens or locally buy at a pharmacy called the Today Sponge, and it was a cervical cap. And then there's spermicide jellies and suppositories that you put into the vagina. Okay. Then of course, birth control pills are going to be progesterone. And really what happens with the birth control pill is we maintain a luteal phase. And then you're in that luteal phase for 21 days. So you take progesterone for 21 days, your brain thinks you're pregnant, right? And then the last 7 are just the vitamins. So as progesterone falls off, you should have a period, right? So a lot of women get put on birth control pills to regulate, to give them a period, to get them on a 28-day cycle. Especially athletes, when you have a lot of testosterone being made in your body anyway, that can throw the thing off. Then there are some skin patches and rings that emit the hormones, right? My wife has done what is that one? I'm trying to remember the name of it. We get injections once a month, the Fovero, and you get a shot every 3 months, and you don't have a period. You don't have a period. Okay, and then I love the implants here too. You can put these little implants in your arm that can last up to 3 or 4 years, and they release your birth control pill for you. They're like time release birth control pill. Keep releasing those, and that's pretty cool, right? Have some interesting theories on that one, right? Okay, but seriously, seriously, look, if we lead the nation in teen pregnancy, right, which we do, Mississippi, us in Arkansas, then what if we took, this is what I've been telling you, we're not going to do this in lab, what if we brought all the girls in 10th grade, or eighth grade, and said, hey, we're going to give y'all $5,000 if you put the implant in, leave it in. And then your senior year, put another one in, and say you get 4 years of college free in Mississippi. I'm saying, I'm going to, as a state, to pay people to put it in their arms. Not saying go out here and have sex, I'm just saying be prepared in case you decide to, right? Don't have a kid till you're ready. We did that 5, 10 years. I would go from like 50 and everything to like 30, at least halfway up the path. But anyway, interesting. Of course, we'd have to have parental permission for that. IUDs are weird one here. I don't know what were these guys. This is kind of a weird thing. Somehow they figured out that copper stuck up in the uterus will prevent implantation. It irritates the uterine lining, and it also, the copper kills the sperm. Okay, and so these can be put in for 4 or 5 years at times, or even longer. But once again, they had a lot of problems with these in the 70s, and they were banned for a long time. But these have to be put in by a doctor and then taken out by a doctor. Okay, there's our vasectomy and tubal ligation, right? Here's, look at this. I thought you'd love these tables. So if you are completely abstinent and never have sex, that means no ejaculation of vagina, there is 0% chance you're going to get pregnant. Okay, very unlikely, right? Like miracle kind of thing. Okay, with withdrawal method, you'd think it would be 4% failure rate, but it's actually 27% failure rate. Rhythm method is around 25% failure rate. Vasectomy, 0.15% get pregnant a year. So that's your best one. And tubal ligations, really good. Birth control pills should work, right? Theoretically, but we get about a 1 to 2%, 1 to 2% of people on birth control pills get pregnant every year. So not perfect. And of course, the worst one is the spermicide jellies, right? And foam, those are not very good. Okay, those are a really bad idea. Okay, by themselves. And then just going for it, no birth control method at all. 85 women out of 100 get pregnant every year. You know, 85% chance get pregnant if you're having. And we're not even going to talk about what we define as normal amount of sex. We're not even going to go there. Okay, we just have normal sex. Okay, 85 out of 100 get pregnant a year. Y'all, I give y'all a funny joke here to wake y'all up here because y'all are just about in a coma. So I've said that one time that 85 women out of 100 and like I said, I was making a joke, but really, I mean, we're not going to talk about what is normal sex. I mean, like number of times per week or month or whatever. One of the boys raised his hand, and when I said that, I said normal sex. He said, "You mean like missionary?" I'm like, no, I was talking number of events, not how you do the event. Okay, so anyway, so 85 out of 100 get pregnant, and that's pretty wild. STDs, so we got 1 minute. STDs, chlamydia, gonorrhea, wow. Most medically diagnosed diseases every year in America, those two, more than the flu or virus. Syphilis, a bacterial infection, all those can be true of antibiotics. Trichinosis is a parasite that lives in the female and the male. That's a protozoan. HPV, human papillomavirus, causes genital warts, and it's also the cause of cervical cancer. So y'all know cervical cancer is one of the most common forms of cancer. Second most common killer, I think, a third of women, and it can be prevented by getting a shot. We have a vaccine now to prevent HPV. So my daughters have gotten it. So you should get that. It also causes warts, okay? But it is the main cause. It is the cause of cervical cancer. And herpes is a virus that we don't have a treatment for. And there's cervical cancer. And that's good enough. We'll stop there. Y'all have a good day. Thank you for mine. We finished that right on time. Y'all are in a coma today. Man, are y'all tired too? Yeah. Must be. Man, all right, y'all have a good day. Everybody's tired. Ma'am, question.
We won't be here next week because we'll be gone with the chicken in Orlando.
So y'all going to Disney World for the whole week of lab finals?
Yeah, we already talked to our lab teacher.
Huh?
We already talked to our lab.
Okay, good. Okay, yeah, it's fine. Enjoy. Have a good time. Our test is the next week, right? So just be ready for that next week. Okay, yeah, have fun.